Hey everybody. Hey, today we're going to talk about the differences between acupuncture and dry needling. So I've got my friend Benny here, and we're going to do some dry needling on a peroneal tendonitis that she's been having some problems with, particularly when running or biking mostly, Benny? Running, yeah. So the peroneal tendons, they kind of run down the outside of the leg. There's two of them that come down. One attaches here at the fifth metatarsal, and then one goes underneath of the foot. And both can be really painful, particularly when running on uneven ground, or if you're running on a lot of roads that have a bit of a camber on it, that can create a problem. So the difference between acupuncture and dry needling, main difference is mainly intent. So when we're doing a acupuncture treatment, we're often kind of treating the entire body, which means we've got needles and both feet, both hands, the ears, the top of the head, and we're treating a lot of what I would say kind of holistic or kind of full body problems. So sometimes those issues, maybe something like fibromyalgia, maybe even tension headaches. It may be depression, anxiety. We've seen a whole bunch of that this past year with COVID and everything. When we're doing something like dry needling, we're typically working on a specific pain problem. And so dry needling has been around for a long time. And in fact, a lot of acupuncturists use dry needling kind of with every acupuncture treatment, particularly when they're working on a soft tissue issue. And then dry needling has been kind of carved out of acupuncture for some practitioners who don't or can't be licensed in acupuncture. So they take a short class, like a 10 to 15 hour class, to learn how to dry needle certain muscles or certain tendons. Now myself, I've been certified in acupuncture for quite a long time, and so we always do a little bit of dry needling when we're particularly treating a sports injury like this. So I'll kind of show you a little bit of the differences of a fair bit of how you use the needle, where you put it, and then I always combine a little bit of acupuncture with dry needling to make it a little bit better response. So because this is a kind of lower extremity pain issue, we're going to go ahead and put a couple of acupuncture needles in what I would call acupuncture points. So we'll put a couple in the bottom of the feet here. So these are typically pretty small. These needles are about 20 times smaller than the typical hypodermic needle. And so they just can slide in relatively easily. So put one on the top of the foot, one on the side here, gallbladder 41. So again, these are more acupuncture points for pain for the region. And then likewise, I'm put one up in the calf here and one on the side of the leg. So again, those would be mostly acupuncture points treating the region. Now, if we're treating the actual, again, with kind of what we call dry needling, now we're going to really kind of get in and work on this tendon where some of this inflammation is. Certainly, this can get a little bit uncomfortable, so we try to kind of manage that pain with what we're actually working on. Benny's a pretty strong person here, so she probably won't flinch too much. So just a little tap in. And then the difference, again, with if you notice with acupuncture, we kind of get a little bit of movement. But here, we're actually going to do quite a bit of disturbance. So we're actually going to move the needle in and out, kind of around that tendon, even tapping the bone just a little bit. We're kind of trying to create a little bit of micro trauma to the area, which helps the immune system to kind of come in and help to clean that up. And we can just kind of move this around. We can leave that needle in place. We can even take it out and put it in a different spot. Just kind of depends on where we're trying to work and what we're working on. How uncomfortable is that, Benny?
No, it's fine. I actually am feeling the response up the side of my leg into this needle that's here.
In the hamstring, or the IT band, yep. So anyway, so that's the major differences between the two. If you have any more questions, feel free just to reach out to us. We'll be glad to help you. Or you can kind of check our latest blog post that has kind of a better description of what those two modalities are and what they can be used for. Thanks.